Dear colleagues, we have arrived at the end of our EHMA 2024. Before share some closing reflection with you, we would like to celebrate the research presented this year during the conference with our award ceremony. It is my pleasure to introduce Dr. Pamela Mazzoccato, co-director of the Medical Management Center at Karolinska Institute, that will present the Karolinska Institute Medical Management Center EHMA Research Award. So please, Pamela, Dr. Mazzoccato, reach me here.
All right, thank you. It's an honor for me to share with you the information about the winners of this year's Karolinska Institutet Medical Management Center and EHMA Research Award. It's an award that was established to celebrate the best contribution to the field of healthcare management within a PhD thesis. So let's go. Yes. We had 15 applicants. Of those, 5 were shortlisted to have an oral presentation. And I would like to first give an applaud to the shortlisted. And also wish them the best of luck for their academic career. To get to the winners, we had the jury, and the jury was composed by Professor Federica Morandi, Professor Axel Kane, and Professor Maria Jeptwich, who have thoroughly examined the oral presentation and also the abstract that were submitted. And the winners of this year's award are Ms. Anne-France van Eden and Dr. Pedro Ramos. They will have the opportunity to present now their work. They should have an additional award for managing to summarize 4 years of a PhD thesis into 8 minutes. So an applause for that as well. And just briefly about the motivation. So for Ms. Anne-France van Eden, she did her PhD on developing a novel approach, management approach for health, for population health. And the motivation for their work was the extent of research methods that were used, and also the impressive effort to translate the research from one setting to several geographical contexts. And for Dr. Pedro Ramos, who did his PhD on value-based healthcare, the motivation was the contribution to a field that it's yet very much a theoretical field with concrete recommendations for healthcare, for how to translate value-based healthcare from a framework and a concept to practice. So I leave the floor to the winners, and we start with Anne-France.
So thank you. So first, to start off, I'm very honored to win this prize. So I want to thank the Karolinska Institute and the EHMA to have this award, and thank the jury for the lovely comments on my work. Briefly, they were not here, but I want to thank my guidance team for getting me here, guiding me through the process. So that's Mark Bruinses and Victoria Stein. So very briefly, I will try to be as concise as possible. To talk you through some of my research that I've done during my PhD. So my full title will be The Implementation of Population Health Management, Bridging Science and Practice. So that's what I've tried to do. But today I will tell you a little bit more about the Population Health Management Maturity Index that I've developed. And that tool is a learning tool to inspire local health systems to improve population health. So this conference, we heard it a lot. We face big challenges in healthcare. There's workforce shortages, multimorbidity, a growing percentage of older people, and also a lot of technological processes. So we can do a lot, but also with shortages, with costs rising, we need to make some choices. So how will we do that? So that is where we have chosen to look into the approach of population health management. So very shortly, this approach is all about the population. So the population is in the center, and every step, again, you come back to that population. So in step one, it's also defining that population. So who is it that you are accountable for as healthcare provider, as organization, but also broader than that. So it's also looking at social determinants of health, because we know they are very important for the population health. Not going to explain the full cycle because this is really the approach of population health management. And what I've looked into is, if you want to do that, what do you need to do? And actually, what do you need to do first? So it's really nice, really nice theoretical approach. You want to start with doing something else, transformation of the care, but where to start? So we've started in literature to see if there's any information on where to start, what to do first. So we started with the scoping review. We came up with a list of items, so to say, what to do. And then we've presented that to a panel with policy experts, change agents, and we've asked them, if you see these items, do you agree? Are these the most important ones? Are you missing some? So they responded on that, and we started with a mainly Dutch panel, but we've also asked a mainly European panel to validate the items. And from that, we've built the Population Health Management Maturity Index. So from there, we've actually started to putting the tool in practice with a pilot program. And I was able to go to Australia, actually, for that pilot. So that was also for me a huge opportunity to see a different system, see a different country, but also to see if what we've came up with that tool also fits a different system, a different health system, a different culture. And the other research I won't go into due to time. So this actually is a visual of the Population Health Management Maturity Index. So it's consisting of 101 items divided into 6 domains. And the most important one is that it's the population health management cycle is in the middle. So you need to connect all these domains. And I know that's easier said than done, but that's a really important part of this maturity index. It can help you where to start, but I want to stress that you need them all. So you need an accountable care organization. So you need a collaboration between organizations, between social domain and medical domain. You need to find the financial aspects of the health system, also to incentivize everyone to work for that same strategy that you want to improve on. Within population health management, you need a data infrastructure. You need to be able to share your data, share them between organizations. But you also need the data professionals that can truly say what you can say about the data, and also, very importantly, what you also can't conclude from it. And what we want to stress is that in connection is really important, going back to the population, asking them what they need, what their needs are, and how you can improve on that. So that's improving, co-designing with the workforce and the community themselves. So it's around the population, it's around the people themselves, but in connection with the system. Because if you don't get the financial resources, you can't proceed, and it's not sustainable. So with this tool, you can actually check whether or not you have the strengths and weaknesses in your system to be able to do population health management. So for now, the tool is positioned as a learning tool to support strategic prioritization in your region and plan the transformation journey. So at start, it assesses regional maturity with scores, but most importantly, with the conversations with the stakeholders in the region to get that going. And in this way, it can highlight potential gaps in knowledge and also expertise that is available in the region. So you also are more aware than which kind of expertise you need to invite into the transformation process, specifically for your region. So in that way, it really stresses strategic opportunities. So give an example very shortly, in Australia, a lot of stakeholders are really used to respond to, for instance, bushfires and flooding. So the stakeholders can very quickly respond to that. But what we also saw is that whenever the first response is finished, stakeholders go back to doing their own thing. So they want to strengthen that collaboration and use it as an opportunity and use that history of collaboration within quick responses to actually build on that and more formalize that collaboration that's already there. So what we really would like to do is to make sure that this tool can be applied into all different countries, different regions, to also assess the differences between regions and the differences between health systems, to give a more precise answer on that question, where to actually start. So that would be really nice. We're now starting in the Netherlands to broadly use the tool. So I will progress on this further. So to conclude, some very brief learnings for myself, what I saw in bridging science and practice, but also bridging policy and the community and everything in between. It's a lot about the use of language. So it's really important to adjust your language to the audience, but also to the people you speak to, and try to adjust and get the message across. But also, on the other hand, really listen to what their needs are and how you can together fix the system and fix and get the interventions that you need to help the population. And it was really nice to have these different research methodologies, but also it was a balance between sometimes getting the speed that sometimes is necessary for practice and getting the rigorous methodology from science in there. And I was very honored to have that experience going abroad, going out of my own comfort zone and getting to know new people and really truly starting to listen to other experiences. So that's something I want to progress on further. And finally, I want to finish with a last question actually to the audience. So we've heard this conference a lot about transformation, about change. So there's a lot to do. So my question would be, which strategy do you choose to start tomorrow? Thank you.
So, first of all, thank you to Karolinska Institute and to EHMA, and maybe also a special word to Mats Brommels, who was the person or one of the persons that initially was a strong motivator for this award. Apologies for ending the conference with a little bit of gloomy theme, like abandonment of value-based healthcare, and especially considering that value-based healthcare has been so much in the agenda also in this conference. But value-based healthcare, as has been discussed extensively in this conference, is a strategic management framework that at its core has the goal of improving value for patients, and with value as the relationship between outcomes and costs. It has been touted as the strategy that will fix healthcare by its own ideators, and also thought about in 6 sub-strategies, so 1 to 6 that you see on the screen. So organize into IPUs, measure outcomes and costs, move to bundle payments, integration of care delivery systems, expand geographic reach, and build an integrated IT platform. The reality is that what we actually know, what we do know at this point about value-based healthcare is that most of the examples come from the US. Doreen, that was also present in this conference, was one of the researchers that studied also with scoping review empirical examples, and what was found was that there was a predominance of a few components, but rarely the entire framework as it was presented in the previous slide. And also our group at KI a few years ago showed that there is an evidence of some pseudo-understanding. So actually what people say that is value-based healthcare in core concepts like value or even outcomes conflicts a lot with what was the ideator's original idea. So a few years ago, it started to beg the question for us: is value-based healthcare the latest example of pseudo-innovation in healthcare? And why don't study then this with at the time? Well, Karolinska University Hospital is a public hospital in Stockholm, University Public Hospital, also tertiary hospital for Stockholm, Sweden, and in a few areas even for the Nordics. And a very visible example in 2014, 15, 16 of adoption of value-based healthcare. A very visible, a very loud example. And a part of that loudness was also because of the boldness of its approach. Value-based healthcare came, you see it, I cannot point, but you see it in the top of the screen, just a small part of a broader transformation framework that included several things. Each one of its own, it's an entire change project, like going into a new building, like having more national agreements or network healthcare, things that are, as you see there, some are given prerequisites. So it wasn't, or some argue that it wasn't even the decision of the hospital. It was a decision of the entire system and the entire regional system. But the idea is that it was involved in several things. Our first paper showed that at its core, the main value-based healthcare innovations at Karolinska were three. One was this what is called new operating model, so a patient flow-based organization. So Karolinska actually restructured the entire production, the entire organization towards a matrix organization with themes and functions and more than 200 patient flows. The idea of these patient flows was that employees had a specific competence that was patient group specific, and with that they would create a higher impact, a higher value for the patients along this patient flow. So a bit aligned with the idea of the actual IPUs, of the actual integrated practice units. A second innovation was these digital dashboards, so what was called the steering cards. And again, here the idea was focusing on outcomes and costs per patient group. So if you had the data, if you had the information on both outcomes and costs, you would be able to steer. That's why they were called steering cards. That you will be able to steer the flow, steer the work at the hospital towards what would improve the highest value. And thirdly, a patient flow leadership group, what was called the oval tables. And this was an interprofessional and interdisciplinary team that was, again, specific to each patient flow, that had a patient flow manager, which was called at the time patient flow captain. So again, very aligned with some concepts of initially of value-based healthcare, others a bit tweaked, but yeah, these were the three main innovations. And then, so the last slide, I talked a little bit about what was the idea, and now what we found. So regarding the patient flow organization, so the new operating model, what actually did we learn? We learned that what was initially an idea of reducing fragmentation between clinics actually resulted in care fragmentation within the same clinic. So there were higher difficulties to cross-referral patients even between flows that were within, let's say, cardiology or oncology, that were easier in the beginning, previously. Also a strong need, and because of this, to deploy cross-functional structures to improve coordination. So joint ward rounds, new units for multimorbidity. So a lot of investment on these like cross-functional structures. Production and finance KPIs did not follow the patient flow structure. So actually they were still at the department level. So you would have on paper what was the patient flow structure, but then the actual production, the actual economics were still at the department level. This also resulted in more like soft, let's say soft or psychological consequences. One was this power struggle. So smaller units, lower budgets. Suddenly there was a lot of managers that were struggling regarding also their own units. And also professional identity challenges, especially amongst physicians. So suddenly you're not a cardiologist, you're a patient flow manager in a specific area. So I need to hurry up. Okay, last slide. So what was adopted and abandoned of value-based healthcare at KI? What was adopted? What is still present in the end? The matrix organization, so this is still there. The patient-reported measurements, the PROMs and the PREMs, and the patient participation and co-creation culture. What was adapted? So what took new forms? What is different from what was initially conceived? So several patient flows merged, and they are more similar now with larger units, so what was before. Also, accountability on operations came to the operations managers and not to the patient flows. Steering cards turn much more into production and not outcomes, actually. And the oval tables become much more at the unit level. And what was abandoned? So the hospital and the university had this idea of mirroring organizations, which never occurred. Patient flows as organizational units is over. Flow managers as these innovators in each one of their areas is also something that didn't fly. And finally, these outcome steering cards are pretty much deprioritized, and much of the work now is also, again, with national quality registries that have been in Sweden for a long time. And finally, the last slide. So what are the insights for managers that I personally draw? One is there's a lot of piecemeal adoption in value-based healthcare. So since the framework is too large, you actually choose what you want from it. But we start to need to think of what is the hardcore of value-based healthcare, what is immutable. Otherwise, it's not value-based healthcare. You cannot really assess its impact because it's not there. And we believe that at least it's looking at things jointly as outcomes and costs. Reducing also the data requirements. So in a way, there's a lot of move towards theoretical standard sets and the idea of actually using what is already there, what organizations already have. Also, I think we need to start thinking about funding investments. These transformations in many cases require what has been called liaison devices. So even these cross-function organizations, and this requires more type of innovative funding. And we have, I think, a good example in Stockholm for making this happen. And finally, more partnerships between payers and providers, and specifically payers starting to become more strategic purchasers. Sweden and Stockholm had these bundle payments, but that was never integrated with any of these. So really how we can have more partnerships between payers and providers to steer value-based healthcare. So sorry for the delay, but thank you.
Okay, so now I'm pleased to announce the EHMA Awards. Every year, the EHMA conference brings together top quality research from Europe and beyond. We take pride in providing a platform to share health management knowledge, research, and inform evidence-based policies. So I would like to announce first award. The EHMA Award for Best European Paper goes to Olivier Grimaud with the work Mapping Competency in Public Health Training Experience of the Euro Pub Health Consortium. Okay, now we have the EHMA Award for Best Non-European Paper, which goes to Alina Timotin. I don't know if she's here. The work is Online Presence of Family Doctors and Institutions in Primary Health Care. I think she is not here, so she will receive the award later. And last, the EHMA Award for Best Poster goes to Anu Vekamaki. The poster is Enhancing Healthcare Continuity, Design Principles for Addressing Patient Journey Disruption. Yeah. Okay. Now, the announcement you have all been waiting for, which is where we will meet next year, so a little bit of suspense.
Mesdames et messieurs, je suis heureux de m'adresser à vous en cette clôture de cette 29e conférence annuelle de la European Health Management Association à Bucarest. Je regrette de ne pas avoir pu prendre part directement à vos échanges. En tant que ministre de la Santé et de la Prévention, je suis ravi d'annoncer au nom du gouvernement français que la conférence européenne sur la gestion de la santé de 2025 se tiendra en France, à Rennes, du 3 au 6 juin 2025, co-organisée avec l'École des hautes études en santé publique. Si la France dispose d'un système de santé reconnu pour sa résilience, son accessibilité et son efficacité, c'est grâce à l'engagement quotidien des professionnels qui veillent aux besoins de notre population. Nos dirigeants, cadres et managers, dont je tiens à souligner l'excellence, sont indispensables au bon fonctionnement et à la performance de nos établissements de santé. Leur engagement et leurs compétences d'adaptabilité nous ont permis de mettre en œuvre des réformes, des transformations et des innovations qui placent la France parmi les leaders en matière de santé publique et de management des organisations en santé. Ces résultats, nous les devons en France à la prestigieuse École des hautes études en santé publique, qui est un partenaire clé du ministère de la Santé et de la Prévention. Cet établissement d'enseignement supérieur et de recherche, qui bénéficie d'un fort ancrage professionnel, forme les futurs cadres de notre système de santé tout au long de leur carrière. Le HESP transmet aux cadres de santé publique des connaissances et des compétences de haut niveau qui leur sont nécessaires pour exceller dans leur mission et leurs responsabilités. Les synergies fortes entre le ministère et cette école constituent un pilier fondamental de notre système de soins. Je souhaite que la conférence de 2025 constitue une nouvelle opportunité pour mettre en lumière nos meilleures expérimentations et innovations en management de santé. C'est en partageant nos savoirs et nos expertises que nous pouvons apprendre et explorer collectivement des solutions pour renforcer la mobilité, pour renforcer aussi la formation, le bien-être et l'innovation au sein de nos systèmes de santé respectifs. Cet événement doit aussi nous servir d'impulsion pour développer des collaborations transnationales et des stratégies communes dans le contexte des grandes transitions numériques, environnementales et démographiques. Je suis donc impatient d'accueillir la prochaine conférence qui, je l'espère, sera une réussite pour renforcer notre Europe de la santé. Merci à toutes et à tous et à l'année prochaine en Bretagne, en France.
So EHMA 2025 goes to Rennes, France. We are very delighted to have another fantastic local co-host in the École des hautes études en santé publique, a long-standing member of EHMA. So let me invite my colleague and please.
Thank you, Frederica. So, dear EHMA members, colleagues and friends, it's with immense joy and great pride that I take the floor today at EHMA conference here in Bucharest. On behalf of the entire team at the EHSP, you should know that now, learn that abbreviation, EHESP, should repeat again until next year. On behalf of the entire team, I would first like to thank our hosts for their warm welcome here and the impeccable organization of this memorable event.
It's with great excitement that we will co-host the next edition of the EHMA Annual Conference in Rennes, France, at the EHSP. Rennes, the capital of Brittany region, is a city rich for its history and culture, offering a great human-sized setting for our next gathering. Our institution, renowned for its academic excellence and commitment to public health, is honored to host this prestigious event. We eagerly look forward to welcoming you to our facilities and showing you our beautiful regions, and I warmly invite you to join us in Rennes. Your presence, your expertise and commitment are essential to making this event a resounding success. Prepare yourself for inspiring, interactive sessions, enriching sessions, enriching discussions, and unique networking opportunities. Additionally, Rennes will provide a pleasant setting for you to discover beautiful Breton seaside landmarks, its cuisine, and its heritage. Thank you again for this wonderful gathering, and see you next year in Rennes. Bye.
Okay, we are now at the very end of these 3 intense days that were inspiring, challenging, and full of meetings and opportunities to exchange. I have felt a real great and positive energy, and I'm sure you did you too. In concluding this wonderful conference, I would like to thank the many presenters that made this conference possible. A heartfelt thank you to Pfizer, Philips, MSD, the Alliance for Value in Health, the European Observatory on Health Systems and Policies, the Univans Award for Healthcare Excellence, Health Assessment Europe, and Candia. And I would like also to take a moment to thank the Minister of Health of Romania, Prof. Dr. Alexandru Rafila, for graciously endorsing this conference. Our member, the National Institute for Health Service Management. A special thank to Prof. Cristian Vladescu, Director General of the Institute, Dr. Gabriella Scinte, Deputy Director, and Dr. Aurora Dragomiristeanu, Director of the Center of Excellence in Capacity Development for Health Service Management. So I would like to invite here Dr. Gabriella Scinte and Dr. Aurora Dragomiristeanu. Please.
Well, thank you very much to everyone for the participation, but especially to EHMA that accepted to organize this meeting in Bucharest. We were honored, especially that we've been in many international projects, and Bucharest was many times not the first choice to go and to have a meeting. But I hope you felt well in Bucharest. And I also want to make a disclaimer, because as I told to Francesca earlier, I felt embarrassed many times that someone congratulated me for the excellent organization. So we were co-hosts of this event.
the organization, all the greetings and congratulations has to go to Francesca and her team. So thank you, Emma, for coming to Bucharest.
And I would like also to make a special mention to Dr. Theodor Blindaru, who accepted the role of Master of Ceremony for this conference. And a special thanks also to World Health Organization Europe and World Health Organization Country Office of Romania for their support in realizing this conference. I would also like to thank each and every one of you for being here and having contributed with your research, your insights, your experience, and your knowledge. And a special thanks to the fantastic team of EHMA that each year organized this very magnificent conference. So, thanks, and see you next year.